Skills everyone should know. In emergency situations, knowing how to save someone's life can be critical. Cardiopulmonary resuscitation, CPR, and basic first aid are essential skills that can help individuals provide life-saving care until emergency responders arrive. This article will discuss the procedures and steps involved in saving someone's life during an emergency. Cardiopulmonary resuscitation, CPR. CPR is a life-saving technique used to help someone who has stopped breathing. In the event of cardiac arrest or other serious conditions, CPR can be the difference between life and death. The American Heart Association recommends that bystanders know how to perform CPR on adults, children, babies, and elderly people who are not breathing normally. To perform CPR, begin by checking if the person is breathing and has a pulse. If there is no breathing or pulse, start chest compressions and breathing immediately. CPR involves giving chest compressions and breathing for a short period of time until emergency medical services arrive at the scene. You can learn how to perform CPR by watching instructional videos or taking a CPR course. Respiratory arrest. Respiratory arrest is a life-threatening condition that occurs when the heart stops beating and blood flow to the brain stops. This condition can be caused by underlying diseases or conditions such as a heart attack, stroke, or pulmonary embolism. If you find someone who is unconscious, check for breathing and pulse. If there is no breathing or pulse, start CPR immediately. Cardiac arrest. Cardiac arrest is a sudden loss of heart function, which can occur to anyone, at any age and in any setting. If you witness someone experiencing cardiac arrest, call 911 immediately. Do not wait for another person to call on your behalf. If there are no cell phone reception towers nearby, use an outside line to call for emergency services. Stay with the person until help arrives. Keep them warm by covering them with blankets if they're outdoors or inside if it's cold outside. If someone else comes over to help them before the paramedics arrive, do not leave until the emergency responders arrive. First aid basics. In addition to CPR, knowing basic first aid skills can also be critical in emergency situations. Basic first aid skills include helping someone who is choking or having a seizure, helping someone who has a heart attack, stroke, or other medical emergency in the home. If someone is choking, ask them if they can speak. If they cannot speak, perform the Heimlich maneuver by standing behind them, placing your hands around their waist, and applying pressure to their abdomen. If someone is having a seizure, do not try to restrain them, but instead move any dangerous objects out of the way and cushion their head. Knowing how to perform CPR, cardiopulmonary resuscitation, and first aid can be the difference between life and death in an emergency situation. While CPR is a critical tool in helping someone who has stopped breathing, first aid is equally important in providing initial life-saving care before professional medical assistance arrives. Cardiopulmonary resuscitation, CPR. CPR is a procedure that helps someone in cardiac arrest. It involves giving chest compressions and breathing for a short period of time until emergency medical services arrive at the scene. Here's how to do CPR. Check for responsiveness. If you find someone lying on the ground, gently tap their shoulder and shout, "Are you okay?" Call for help, like 911 in USA. If the person doesn't respond, call for help immediately. If there's no one around to help, call for help first and then start CPR. Begin chest compressions. Place the person on a firm surface and kneel beside them. Place the heel of one hand on the center of the person's chest, and put your other hand on top. Press down hard and fast, about 100 to 120 compressions per minute. Give rescue breaths. After 30 compressions, tilt the person's head back and lift their chin. Pinch their nose shut and give 2 breaths into their mouth. Watch their chest rise and fall as you breathe for them. Repeat compressions and breaths. Continue the cycle of 30 compressions and 2 breaths until the person shows signs of life or medical assistance arrives. Other first aid techniques. Knowing how to give first aid in other medical emergencies can also help save a life. Here are some basics. Choking. If someone is choking and can't talk, breathe, or cough, give them back blows followed by abdominal thrusts, Heimlich maneuver, until the object is dislodged. Seizures. During a seizure, keep the person safe by cushioning their head, loosening any tight clothing around their neck, and clearing the area of any sharp or dangerous objects. Don't try to hold them down or stop their movements. Heart attack. If someone is having a heart attack, call for help immediately and have them chew an aspirin, if they're not allergic. Loosen any tight clothing, and have them sit or lie down. Stay with them until help arrives. In any emergency situation, the most important thing to remember is to stay calm and call for help. Knowing how to perform CPR and first aid can make all the difference in saving a life. Don't hesitate to learn these life-saving skills today, and always be prepared to act in case of an emergency. For more content, visit us at topicuniverse.com.